Hi, I'm Luke Blake, and I've invented a new concept of dressings to be used in and around the hospital as well as in the intraoperative setting to cover peripheral vascular, central vascular, and nerve block catheters. It's a simple concept of one dressing being built right over the top of another. In the intraoperative environment, following the surgery, it's my job to remove these surgical drapes off of patients. And the surgical drapes get adhered to the dressings, and it's very tedious to separate the two, preventing the catheter from being pulled out.
As an anesthesia provider, we've been waiting for a product like this to hit the market. This market can have profound impact on a couple different areas. The first area of impact is patient safety in the operating room. It decreases the amount of dislodgement of catheters simply by the top layer peeling away, leaving an occlusive bottom layer. The second area of major impact is decreasing bloodstream infection rates. That's a $20 billion industry, and we have a chance of reducing bloodstream infections by up to 50%, simply because we're decreasing the frequency of dressing changes due to soiled lines.
So now we're demonstrating the concept of a two-layer dressing, in which the first layer is meant to peel away with the drapes, protecting and leaving behind a perfect dressing and, more importantly, catheter underneath it.
As an anesthesia provider and also a former pediatric nurse, I know that this type of dressing has profound impact in our most vulnerable population. The pediatric population is at high risk for central line infections. This dressing can decrease the amount of exposure that the patients can have by up to 50%. Simply speaking, pediatric patients can soil the dressings and they need to be replaced. This dressing can have the top layer simply removed, relieving the bottom layer intact. Once that layer is still intact and occlusive, it decreases the exposure to infectious materials.
This is an inexpensive solution that has a massive impact across every operating room in the country.